Hi, all of you would have come across a syndrome called LENNOX-GESTAUT syndrome when reading about epilepsies. This syndrome has got very peculiar features. I am going to list out important peculiar features, and many of the entrance exams have asked about LENNOX-GESTAUT syndrome. It's a very important condition which every one of you should know. What are the characteristics of Lennox-Gastaut syndrome? First of all, it is characterized by a triad. What is the triad? Let us see later. Second, it is characterized by something called drop attacks. And these drop attacks will lead to multiple injuries, bodily injuries. And many of the time, parents will come to doctor and tell that my child is falling while playing, suddenly he falls, and then he has sustained injuries multiple times. But when you inquire, they might reveal that the child may be losing consciousness that time, may be unaware of the surroundings for a brief period of time like that. So drop attacks leading to multiple injuries is an important clue towards Lennox-Gastaut syndrome. It is commonly seen between the age of 3 to 10 years. And this may evolve from a syndrome called West syndrome. All of you might have come across this syndrome called West syndrome. It is again characterized by a triad, which I will briefly tell in the end. Lennox-Gastaut syndrome is a very highly drug-resistant epilepsy, and multiple anti-epileptics have failed in treating Lennox-Gastaut syndrome. The exact cause is not known, and it is believed that it is due to multifactorial etiology. We'll come back to what is the triad of Lennox-Gastaut syndrome. It is characterized by point number 1, multiple seizure types. The seizure types can be generalized tonic, generalized atonic, and atypical absence seizures. It can be of some other seizure types also. Second component of the triad is interictal EEG abnormality. What is the meaning of this? When you do EEG after the attack of seizure, you can see that it is characterized by a slow and spike discharges during awake state. This will lead on to a burst of paroxysmal fast activity during sleep. So in the awake state, it is characterized by a slow spike wave discharges. The frequency of slow wave discharges is about 2.5 hertz, and this will get progressed to a burst of paroxysmal fast activity. The frequency is 10 hertz. So there the frequency is 2.5 hertz, here the frequency is 10 hertz. That is during sleep. So you have two peculiar EEG abnormality. One during awake state, it is slow spike and wave discharges. During sleep, it is burst of paroxysmal fast activity. Now the third component of triad of Lennox-Gastaut syndrome is cognitive dysfunction. Okay. I hope this is very clear. Now a brief information about West syndrome. West syndrome is again characterized by a triad of number 1, infantile spasms, second, arrest of psychomotor development, third, hypsarrhythmia in EEG. Many entrance exams have asked a lot of MCQs about West syndrome. The questions are like this: hypsarrhythmia is seen in which of the following syndrome? Infantile spasm is seen in which of the following syndrome? Okay, like that many questions have been asked. You should be aware of these things. And one more thing, this infantile spasm will lead to spasm of the hand, and the infant will bring the hand towards the forehead, and this will look like a salam, and that's why it is called as salam attacks. Okay, salam attacks is nothing but infantile spasm which is seen in West syndrome, and this West syndrome over a period of time can progress to Lennox-Gastaut syndrome and becomes drug resistant epilepsy. Thank you.